Hello again. It was nice to formally meet you guys, or informally, on the self-introduction video. Um, but in case you missed it, my name is Benjamin Rodriguez. Um, and for my 15-minute skill video presentation, I am going to be doing a overdose scene, Narcan administration. I do want to give you a full heads up. I am not a truck EMT or a truck medic. So I am solely going off of everything that I have learned in EMT school, which was a couple years ago, with some help of some friends in the CP program that do the narcotic overdoses. They deal with those patients, and I'm got a little bit of information from them. But I do want to run you guys through the scenario. I am going to be in my personal work truck that I use to get around the county to deliver supplies and stuff. On that work truck, I do keep safety vests and PPE stuff. Also do keep a set of bags, an oxygen bag, medication first aid bag. So just in case I do run up on something like this. Again, I'm not a trained professional that does this day in, day out, so I may and probably will miss some steps. This is kind of where you guys come in and help me get better on the stuff that I miss, or give me some pointers. I'm not going to turn that away. But the scenario is that I'm on the way to lunch with some coworkers. I told them I would meet them there. I was the first one there, and I'm driving, and I'm going in the parking lot. For this scenario, I'm just going to be going to La Cocina in Smithfield. I'm going in the parking lot, turning in. I see a female, appears to be unconscious, laid out on the ground. Obviously, my first step is going to be check for scene safety, make sure I have my PPE, make sure I have my bags, making sure all that's good to go. Again, not a professional here, but we'll take any tips. I'm going to edit the video and put that in here. So let me know what you guys think. Okay, as stated before in the introduction, I see the woman just laid out on the ground. I'm gonna grab my bags and my vest, make sure PPE and all that stuff is good. I'm gonna assess the scene real quick. I don't see any moving cars. I don't see anybody else around her. There's no other hazards. So with that being said, scene safe, PPE on. I'm gonna lay my bags down. Hey ma'am, are you okay? I'm gonna start by making sure, see if she's responsive. I don't see any breathing, but I do see white stuff coming out of her mouth. That being said, I'm going to do a quick check on the pupils with my light. We're going to sweep them from left to right. Open this eye slowly. Okay. That eye is completely pinpoint. Other one is completely pinpoint as well. I don't have a partner with me, so I can't secure C-spine or anything. But with that being said, I'm gonna make sure her airway's good. I'm gonna turn her head towards me a little bit to allow the stuff to drain out of her mouth. I'm going to get my, my oxygen tank, turn it on, get a non-rebreather on, turn to 15 liters of oxygen, putting the mask on now. Okay, ma'am, are you okay? Still no sign of response. I'm going to go in my med bag and grab a the Narcan. For this snare, I'm going to be using the auto eject 4 milliliters. So with that being said, while the non-rebreather's on, bag's inflated, I'm going to check again. Are you okay? No, no response. I'm going to open the non-rebreather a little bit. Go ahead and administer the dose. Once I administered it, place it to the side. It was sternum rub. Hey ma'am, are you okay? Anything? Kind of shake her a little bit. Okay, I hear the patient grunting, making some kind of noises. Okay, the air is still on. I'm going to check for a pulse. Okay, I feel it there. I'm going to check right here real quick on the artery. All right, patient is breathing a little weird. I'm going to grab my stethoscope, listen to the lung sounds. After I administered it, I want to make sure that she's okay. So I'm constantly going to be checking. Ma'am, are you okay? Do you hear me? Do you know where you are? Nothing. I'm going to go ahead and call 911. I'll do that now. Just found, I guess I found her phone, hit the emergency contact, call 911. Ma'am, can you hear me? Still nothing. I'm on the phone with 911. Yes, ma'am, this is Ben. I found a patient unconscious. I suspect a drug overdose. I did check pupils or pinpoint. I did administer 4 mL Narcan on the right nostril approximately a minute ago. Patient is now doing grunt noise, very little noise. She is breathing a little bit. I think I am going to have to administer a second dose. Could you please send ambulance and supervisors to this location? All right, thank you. EMS is on the way. All right, at this time, she's still not waking up. I'm gonna throw a blood pressure cuff on her, on the right arm, right above the artery. I'm gonna check it. All right, she is hypertensive, which indicates that it was an overdose. She's still, ma'am, she's still not responding. Ma'am, are you okay? No? All right, so we're gonna go ahead and grab another dose of the 4 mL. Make sure the right dose, right patient. Go ahead, lift up the non-rebreather, spray it again, do the sternum rub, shake it a little bit. Ma'am, are you okay? As you see, we got a little more response out of that one. Ma'am, are you okay? I'm going to continue my assessment until EMS gets here. Make sure that everything's good. Okay? Patient starting to become a little more combative. Ma'am, I'm Benjamin. I walked up. You were laid out. Do you know anything? Did you know what you took?
I told him that.
So patient's not providing me with information. However, she is breathing again. I'm trying to keep the non-rebreather on. She keeps trying to take it off, but I advise her it's her best interest to keep it on, so just keep it on. Are you okay? This time I kind of like to look around and make sure that there's no hazards again, no bullet holes that I see. I'm gonna be doing a quick sweep, see if I see any blood or anything. Do you know how you hit your head? Did you hit your head or anything?
Oh, no.
Okay. Well, but I think I hear EMS coming now. So, with that being said, ma'am, I'm going to advise you to get transported. Is that okay with you?
No.
Do you know, what is your name?
Um,
Did you know what you took?
um,
Do you know what day it is?
November.
Do you know who the president is?
Not Orange Man.
Okay, so, EMS arrived here. Would you be interested in going to the hospital today?
No.
All right, well, we do offer services for drug users to maybe get some help. Would you be interested in hearing about that?
Yeah.
All right, well, before I leave the scene, I'm going to make sure that you're able to sit up and stand up on your own before I leave you. All right, can we go ahead and do that? And I'm using this time to look at her back, make sure that nothing is bleeding, no holes, exit wounds, or anything. All right, well, with that being said, I'm gonna leave her to the professional care of our good EMS folks in the county. Thank you. So as you guys just saw my horrible acting and my good work, I would say. There are some things I forgot to mention. After the patient sat up, I would definitely contact my supervisor and tell him what happened. Kind of explain the scenario to him again, make him aware of the fact that I ran a call, most importantly, but also the patient had a successful outcome, and making sure that all documentation is correct for the administration of the Narcan. Kind of as I stated to the patient in my scenario, we do offer services for people that have issues with overdoses. It's kind of a service that the community paramedics offer. It's a really good service. So this is interesting to learn. Like I said, I don't do this full time, but I was just talking to them a little bit, kind of explaining the fact that I had to do this assignment and kind of give me some quick tips and a quick rundown of what to do, what to look for, correct way to administer, correct way to document. I know a lot of that stuff that I did may not have been correct, but it's kind of like the gist. So I hope you guys enjoyed it. Maybe you'll get a laugh out of it. I know I had some fun doing it. And hope to get some response back. Pointers, all of that is accepted, as I said before. Thank you. So I completely forgot about some of this stuff last night in the video, but decided to come back and put it in. A couple of things I forgot to do. When I was on the phone with 911, I forgot to tell them the location of the emergency. Rookie mistake. That was really important to, obviously let 911 where the incident happened. And then when EMS took over, the great professionals that do this day in, day out, I forgot to tell them kind of how I found the patient when I arrived, give them the quick patient rundown, let them know all the information that I found out. Also, I forgot to tell him, hey, I administered Narcan twice. This was the baseline vitals for after the first time I gave it to him, and then the vital signs after I gave them to him the second time. So those are very key facts that I forgot to put in the video, but went ahead and put them in now. So.